Hello, welcome to Dr. Kelvin Nguyen channel. Today, Kelvin would love to talk about the sister disease to hepatitis B. That's how I actually call it to my patients. It's hepatitis C. Very lucky to us, hepatitis C has a cure now, and very similar to hepatitis B. These two are considered as a viral hepatitis, and the disease is actually transmitted in a very similar way to hepatitis B, basically through blood and through body fluid exchange. So usually when people come to Kelvin Clinic nowadays, if they're already diagnosed with hepatitis C, and how do they get diagnosed with it? They actually get blood tests and get screened for it. In the past, we recommend that for anyone that were born between 1945 and 1965, or anyone with any risk factors for blood transfusion, if you work in medical field that you can potentially have some body fluid exchange, then you should be screened and check it out for hepatitis C. But nowadays we apply universal testing. That means that anyone can be tested for hepatitis C when you go talk to your primary care doctor. And so a blood test would reveal that you were exposed to hepatitis C or not. I didn't say that you might carry it still, but at least we can check and see you were exposed to it or not. 85% of patients with hepatitis C that were exposed to it would develop chronic hepatitis C, meaning you are a carrier for the virus. Now, once the disease is already established that you have it, the next step is how we can treat it. So back in the days, you might have heard stories that people have hepatitis C and they treat it with interferon and ribavirin. These are the most common medications that were used with very low successful rate. In fact, it's only up to about, I would say, 60% at most that will be cured from hepatitis C. And the drugs are terrible with a lot of side effects. You have patients on interferon that basically having nausea, vomiting. They have to have their bed set really close to the toilet or the restroom so that they can run to the restroom very quickly, just in case they have nausea, vomiting, which can be very problematic for many patients. In addition, ribavirin is also another older drug that we use, can have some side effects as well. They can drop your red blood cell count, and you can develop anemia from it. So these are terrible drugs, but at that time we didn't have a choice. Fortunately, about 15 years ago, a new drug class that just came out, for short, I'm just gonna call it DAA. And this drug is just a pill taking daily. The first generation of the drugs is actually have a lot of side effects as well, and we actually don't use it anymore. But nowadays, we have much better drugs that you take it once a day with very minimal side effects, and for the most part, all of the patients take it for 12 weeks, and after that, the success rate is 95 to 99% that you actually cure from it. That's how awesome it is. And I would say that drugs that can be used for hepatitis C is one of the most, I would say, wonderful breakthroughs in medicine, because now we have a cure for it. So as you can imagine, what is the routine that Kelvin would encounter with someone with hepatitis C that come into clinic, right? So you come in, you have hep C. Nowadays, Kelvin would do a blood test to confirm what genotype that you have. So what is the genotype? So there are different subtypes of hepatitis C. You can break it down into 6 different subgroups. And the most common one is 1A and 1B in this country. And back in the day, it's supposed to be one of the hardest ones to treat. But nowadays, genotype 3 is the problematic one, meaning there's a little change in the treatment for the virus if you have hepatitis C genotype 3, and Kelvin will talk briefly about it in a minute. Now, after we decide what genotype that you have, we also see how much viral load that you carry, and the next step is there any risk factors for cirrhosis or scarring of the liver? In the previous episode, Kelvin mentioned about FibroScan, which is the modality that very similar to an ultrasound that we use to detect the scarring or the fibrosis of the liver. And with that technology, basically we use the ultrasound probe, we put it right next to your liver, we press the button 10 times, we collect the information, which is 10 different numbers, we come up with a score, which is your average score, we call the fibrosis score, and then we interpret it based on your liver disease status, that where you are in that spectrum is a F0, which is fibrosis stage 0, or F4, which is cirrhosis. And that would also play a role in the treatment plan for the patient. As Kelvin said, after Kelvin checked all of this and make sure that there is no drug-drug interaction as well with some of the medications that these patients take, the two drug classes that usually Kelvin pay attention to, one is we call the acid reflux medication like Protonix or Omeprazole, and then the other one is seizure medications. So if there is a potential for drug-drug interaction, then Kelvin would try to figure out how we can navigate around this. Can we hold the drug for a period of time? If that's okay, and you should reach out to the neurologist, for example, if someone is on seizure medication, or we can switch to something else that is more appropriate while the patient is taking the treatment for hepatitis C. All of that is being done. Now the last step is to check for copay for my patient, right? So in the past, out of the whole treatment of 12 weeks, it would cost about $100,000. It's a lot of money. So $100,000 for one treatment. The number is coming down now. I would say about $20,000. It's still very expensive, but much cheaper than before. And I think in the future, the number, the cost is just gonna keep going down. So we check all of that, make sure the patient can afford it, and then eventually Kelvin say, okay, let's start you on treatment. And if you have any side effects, then let Kelvin know. So Kelvin see the patient for the first time in clinic, do all the work that needed, as Kelvin just mentioned. And then after that, the decision is to treat. I would say 99% of the time, that's how it goes. And after the patient started on treatment, Kelvin would check a blood test on the patient probably about once a month. Depending on the certain treatments, the drugs that we choose, we have a couple options. Some cases that Kelvin had to do blood tests a bit more frequently, but for the most part, we do it once a month. Not that I'm worried that there will be some side effects of the drugs causing any alteration in your blood test results that we have to stop the drug. Majority of the times, it's kind of more a prediction of where the patient is in terms of the viral load. We're hoping after 4 weeks of treatment, if you do the blood test, the number should be very low. If anything, it should be non-detectable. And at week 12, say the patient finishing all the treatment medications, so at week 12, we stop the medication, and then another 12 weeks later, we do another blood test to confirm if the patient obtains what we call SVR, which is sustained viral response. What it means is that the patient now is cured. Very rarely, there are situations that the patient might develop resistance to the drug. That genotype 3 that Kelvin mentioned earlier is one of the potential risks for it, that the success rate can drop to in the 80s, especially if the patient is cirrhotic. And in that situation, we have to do a few testing. We check for genetic mutation. We also want to keep the patient on a prolonged treatment plan, so 16 weeks instead of 12 weeks. We might add some medication to it. So the decision making is based off that particular genotype, where you are with your cirrhosis or fibrosis, and of course the viral load. We also look briefly into that as well. With that being said, many of the patients come to Kelvin with hepatitis C. They've been harboring this virus for years. We're talking about 20, 30 years. So many of these patients potentially at risk for cirrhosis. So unless you already have cirrhosis, then even after the treatment, Kelvin still had to see the patient for the management of cirrhosis, because that doesn't go away, right? So someone already have liver cirrhosis, even though they got treated for hepatitis C, very rare, very, very rare. Kelvin will see a conversion of cirrhosis back to the previous stage, which is F3. So that's very rare for that to happen. So for the most part, if you have cirrhosis, you have Hep C, and get treated for it, you still continue to follow with your doctor so that we can keep you in check for the cirrhosis part, even though the hepatitis C already taken care of. That being said, hopefully you learned something about hepatitis C. The good news is we have a cure for it now. It's not just treatable, we call it a curable disease now. And by getting rid of the hepatitis C, you decrease your risk for inflammation of the liver, you're decreasing your risk for developing cirrhosis, and of course, you're decreasing your risk of having liver cancer. So it's such a win-win situation to be treated. You will be laughing. Kelvin does have patients that say, I don't want to treat, I don't feel anything, which is correct. Many times patients with hepatitis C, they don't feel a thing, so kind of asking them to be treated can be a challenge sometimes. But I hope through this episode, Kelvin convincing you that, it's a good thing to be treated. Who would want to carry a virus even though you might be asymptomatic from it, but it can carry a risk of inflammation of the liver and eventually causing more damage down the road. I'm sorry if the quality of the audio is pretty bad today. It's pretty windy, but I hope you hear me well enough. And it's still a beautiful day. I've been kind of, my eyes are actually having some issue with the light, but hopefully you can hear me well and see me well. And I will see you again next time in another episode. And have a good day. Ciao. Alright, you guys have been watching my YouTube channel of Dr. Kelvin Nguyen. If you really love what you're seeing, please subscribe to my channel. You can do it for me, or you can do it for the duck in the background. They would love it too. See you next time.